हाय फ्रेंड्स, गुड इवनिंग। आई एम डॉक्टर आशुतोष गुप्ता और आज हम बात करने वाले हैं डायलेटेड जुगुलर लिम्फेटिक्स के बारे में। राइट, सो अर्ली इन द एम्ब्रियोनिक डेवलपमेंट ऑफ द फीटस, नेक के पोस्टरलेटरल एस्पेक्ट में देर आर जुगुलर lymphatic sacs actually. So these are benign lymphatic collections, but over the period of time what happens is this, that they fuse and then they have to drain into the interjugular vein. Right, if this doesn't happen, so meaning thereby that a delayed or hypoplasia of the lymphatic systems can lead to dilatation of those lymphatic sacs across the neck of the baby, and therefore it is traditionally being diagnosed as a hygroma coli, right, or cystic hygroma. राइट, सो ये एक आज 12 वीक्स का एक केस है। मैं आपको दिखा देता हूँ दैट हाउ दिस डायलेटेड जुगुलर लिम्फेटिक सैक्स दे लुक लाइक। This is a 12-week scan. So we are able to see the nasal bone very well, upper lower jaw, right? And then you will try to look around posterior aspect of the neck में dilated jugular lymphatic sacs है, which is leading to increased nuchal translucency. And this is the sagittal view of the baby, in which we can really appreciate that the nuchal translucency is slightly higher. The cardiac early assessment at 12 weeks cardiac is absolutely good. ये dilated jugular lymphatic sacs है. So they actually need to evolve when they drain into interjugular vein, can lead to increased nuchal translucency, could be Down syndrome, Turner's, and a Noonan syndrome, right? So these are the possible differential diagnoses. If we look closely at 12 weeks, probably we can identify the dilated jugular lymphatic sacs, right? So ideally they should have fused and therefore they should have drained into the interjugular vein. If this doesn't happen, so that would lead to a cystic hygroma condition called as cystic hygroma. So this needs a sort of an further testing. That further testing depends upon the etiology, and so meaning thereby that we can have a Down syndrome, we can have Turner syndrome, we can even have a Noonan syndrome in the background, right? So meaning thereby that the testing is all different. Noodles could be autosomal dominant. We need a gene sequencing. As far as the Down syndrome and Turner's is concerned, we can do the blood test to the mother as well as we can do an invasive testing. But Noodles would be identified only by the invasive testing. So the whole purpose of making you see and realize is this, that probably identifying the dilated jugular lymphatic sacs would need further. So probably we need to have an open mind, and then probably there are three differential diagnoses that probably we should be worried about: Downs, Turner's, and the Noonan syndrome. So depending upon these etiologies, the testing, fetal testing would be different. Right? Thank you very much for your patience.